On the verge of discussion about the Toronto public health budget for this year, more than 100 emergency room professionals have come forward with an open letter to Doug Ford and the province about what they say is a renewed commitment to cut critical funding. Expect your next trip to the emergency room to be even less comfortable and more frustrating. That's the message from those who work there, including doctors, when talking about the impact provincial budget cuts to public health will have on patients.
I see people vomiting in the waiting room. I go to the waiting room to take care of patients. I go to the EMS stretcher to examine patients. There is no room to lie down.
The open letter to the Ford government cites the opioid crisis and paramedics responding to 188 suspected overdoses last month alone. ER professionals say cuts to prevention services will make it worse.
This is downloading of healthcare onto cities and the provincial property tax base. Let's put this in context. Ontario is the only province in Canada that doesn't fund 100% of the costs of public health.
After backtracking on possible retroactive cuts, the Ford government did announce last month that they would still be moving ahead with a 70-30 cost-sharing split with municipalities, leaving Toronto to make up for $4.3 million in 2020. In a statement to CityNews, a spokesperson from the minister's office said, quote, "We're maintaining current cost-sharing arrangements for public health this year to provide municipalities with additional time to find efficiencies that will ensure the sustainability of public health services."
We recognize our government moved quickly when we came into office to address our inherited challenges. But my friends, we're listening to you.
They added that the letter was written under Councillor Cressy's false pretense that Toronto public health funding would be reduced. Those dealing with patients directly want the province to reverse its actions.
This is a unified opinion by those at the bedside, and I think representing our patients and their patients' families, that these cuts are short-sighted, these cuts are going to affect the public health, and the province needs to reverse them.
From this point, the proposed draft budget will end up going to the full Board of Health by the end of this month before it goes to City Council. At this point, Cressy says recommendations will come forward to save $1.6 million. To come up with more than that, he also says it means cutting services or raising taxes.